Hi everyone. Welcome to our alumni Q&A for the Rush OTD program. My name is Daniela Ugalde and I'm a member of Rush's admissions committee as an alumni. So I attended Rush and graduated in 2024 and I'm happy to be with you all tonight. Tonight we have two wonderful guest speakers who are going to talk to us a little bit about academia and how that ties into occupational therapy. Again, just want to thank everyone for being here and maybe explain a little bit about why, one, I love doing this, but also kind of the purpose. When I was applying for school, it was in the beginning of COVID. So it was really difficult to get shadowing hours. It was difficult to connect with other clinicians. And so when I came on as a member of the admissions committee, I really wanted to think about like just different ways of making shadowing and networking more accessible to a variety of different students. And so thinking back on it, I was like, what better way to connect people and get them excited about going to either grad school, pursuing a field in OT, or even coming to Rush than connecting them with people that have gone through all the same steps. So alas, this was born. And it's been really wonderful just to connect with other alumni, again, get to hear about just um, different places and kind of see like where OT can take you. Again, there's a lot of different specialties and places and like again, OT is just so far and vast, so it's kind of exciting to be able to explore. So again, for all of y'all joining that are prospective students, you guys will be receiving an hour towards your shadowing. So that would be great. And all our current students, what a wonderful way to just network and get to talk to other people that have kind of been in your shoes before too. So without further ado, um, I will have Ashley and Carolyn introduce themselves. Maybe just tell us a little bit about where you currently work, when you attended Rush, um, and any previous OT information.
Oh, Carolyn, do you want to go first or do you want me to go first?
You can go ahead. I don't mind.
Okay. So I'm Ashley. I am the capstone coordinator here at Rush. And like Daniela, I'm also a Rush alum. I graduated in the class of 2021. And I've been in academia for just about a year. Before that, I was and still am an acute care therapist, kind of working all over the place. And I've actually really been enjoying this transition into academia, and I'm excited to talk about what that shift was like going from clinician to education. I'm sure Carolyn, you can speak to it, but it's different than you think it will be, but it's also super rewarding. So glad you guys are all here.
And I'm Carolyn. I went to Rush. I think I graduated in 2018. So I for my master's in OT, but then I also went back to Rush shortly after I graduated to do the PhD in health sciences program at Rush as well. So I graduated that a little more recently. But I did that like part-time while I was working. So it was kind of more of a prolonged process. So now I still work as a clinician, and then I also am adjunct faculty in a different PhD program. And I still kind of work a little bit with the research lab that I did my dissertation with as well. So I'm kind of have like little hands in lots of different pots, which I enjoy.
Awesome. Thank you both. I think I'll just start us off with kind of a general question, getting to know a little bit more about all these little side quests that you guys take part of, and then later I'll open it up to the rest of y'all so that way you guys can feel free to unmute yourselves or pop a question in the chat so that our speakers can answer it. But I'm curious to know, again, kind of what a day in the life looks like. What does it look like when you are doing the academia work? What does it look like when you're doing the work outside of it? If you can just kind of give me some general information of what that might look like day to day.
I can go. Um, so because I'm adjunct faculty in the program that I teach in, I have like lesser of a time commitment to that program than say like an associate faculty. So it's An adjunct faculty is like a PRN, like you just teach one class, like you're kind of in for the one class and then you're out. You're not as involved in just like kind of the overall how the program runs and that kind of a thing. Um, so the PhD program that I teach in is fully remote, and so my students have my class once a week. Many of the weeks were asynchronous, so I'm not logged in at the same time as them. But probably five or six of our course times per semester is synchronous. So we're logging on at the same time. We're going over content, talking, having discussions, things like that. So on the days that I am teaching synchronously, I am like finish my clinical work a little bit earlier that day. And then I just find, hopefully this office is available. Otherwise, I just find a different spot in the hospital where I work, and just open my computer and teach. Um, so I'm primarily in the NICU when I'm in, clinical hours are in the NICU, mostly in a hospital. And then I go on and teach actually about like academic writing. Um, is like the content of the course that I teach in the program.
Awesome. Thank you.
Mhm.
So my day looks a little different than Carolyn's. I do academia full time. So as the capstone coordinator, I meet with students. When you get to your second or third year of OT school, we do lots of planning for what your last year of the program is going to look like, whether you go into research or education and things like that. So I kind of help students figure out what that last year is going to look like. We do contract management. I think so far, in the fall semester, I've had over 75 academic advising meetings, so it's a lot of like face-to-face time with students, lots of faculty meetings, and then in the spring, is when I start teaching all my classes. So I teach one class, two classes a semester, and then I oversee the students while they're on clinicals. And so when anyone on capstone, so if anyone needs anything or has any questions, they're to offer support in addition to all the education piece. And then I do the PRN for my clinical work. So 1 week in a month, I try to get into my acute care setting. So I do gen med once a month just to kind of keep up with my skills in addition to everything I'm doing in the classroom. At Rush, we're expected to have scholarship, service, teaching, and Bridget, what's the last one? I forget. There's like 4 areas we're supposed to be up to snuff in. Um, and so we're kind of juggling a ton of hats when you're doing it full time. But I think the joy is that every day looks a little different. And with every new cohort that we get, so lovely students come into the program, and that really shakes things up for what the full course of the our time together is. Oh, clinical practice, yeah. So I think that's what I love about full-time academia is that no day, semester, year, or cohort looks the same, and getting to know all of you is really fun too.
Awesome. I love it. Again, like same kind of the game falls under the same umbrella of academia, but every day looks a little bit different. I love it. Okay, so this is the fun part where everyone gets to ask their questions. You can pop a question in the chat and type it out, and I'll read it aloud. You can send me a direct chat, you can put it in the group, or you can just feel free to unmute yourself and then go ahead and share a question with the group. Okay, first question. What does the interview process look like?
Think I had a more non-traditional interview. So I was recruited by the department chair to interview for the position, but they do want to know pretty standard stuff like why do you want the job? What does your experience look like? And in academia, you often have to have what's called a CV. So it's almost like a very extended resume in which you talk about everything you've done from your clinical practice to any service work you've done and any research and publications. They kind of want to know it all. And then they also want to know how like effective your teaching is. So sometimes they'll have you come in and like teach a class potentially to see how the faculty and the students respond to that. So I think every program can look a little different with what their requirements look like during that interview process.
And similar to Ashley, the director of the program that I teach for was actually one of the occupational therapists that was on my dissertation committee. And so we had just gotten to know each other well through that process. Um, and then once I finished with my PhD, she let me know that her program had adjunct faculty positions open that she suggested I apply for, with the intention of like me teaching the class that I teach. And so the PhD program that I teach in is a PhD in infant and early childhood development with a heavy focus on like infant mental health, brain development, social emotional health. There's like floor time classes in the program. And so all things that actually aren't exactly aligned with like my clinical expertise. So a lot of the courses in that program, like I would not be qualified to teach. But because the course I teach is on academic writing that kind of transcends, the true course content of the actual PhD program. And so in my interview, the focus was more on like the research that I've done, the type of research that I've done, and the writing and the publications that have gone along with that, because that's kind of more the aspect of my CV that like fit this program or showed that I could teach that course. Um, but it was, otherwise a pretty standard interview process. The director of the program pretended she didn't know me, so like the other people, the other faculty in the interview, like didn't know that she had asked me to apply. So she tried to make it kind of as neutral. Like she didn't want her opinion to influence the rest of the faculty. Um, so it was really kind of like your standard interview process in terms of like an interview with one person and then, okay, they're good. Now we'll do a bigger interview, and then kind of go from there.
Awesome. Next question is, what do you like about working in academia, and is there anything you miss about only working in a clinical setting? I like this question.
I think my favorite thing about working in academia is that I love to learn and I love that in 5 years my job will look different. And so when I was a clinician, I really liked that some places we had clinical ladders and some places we didn't. So depending on where you work, there are like lots of opportunities for advancement, or it's pretty standard of what your day-to-day will look like. And I love the variety of academia. I love the flexibility. I love that we're incentivized to go to conferences. I love that we're incentivized to network and get involved at like the local, state, and international level. Where sometimes when you're a full-time clinician, you only have so many hours in the day, and clinical practice comes first. So I think the variety of academia is really great. Things I miss about the clinical setting is that I do miss being at the forefront of like what's happening in my settings, like in acute care, like when there's new medical devices that come out or new technology or new protocols, like I miss being able to receive that information immediately. When you're working PRN, you're kind of getting things after the fact and like you're constantly having to play catch up. And so that can be the challenging part when you're not there all the time. But I do think like the trade-off has been worth it in my opinion.
Um, I like, I like teaching. Um, I feel like even when I finished OT school, I knew I wanted to teach at some point. I do still think at some point I'll teach in an OT program. I'm just not there yet. But so I like the idea of like when I was in preschool and someone says, "What do you want to be when you grow up?" My answer at the time was a teacher. Like I feel like I've just always enjoyed teaching. When I was full time um in the hospital, I always took students. Like I just liked the kind of idea of like just like disseminating the knowledge and passing it on and making more of us and that kind of a thing. Um, and I really feel like OT school like just shaped how I think, like whether I'm thinking as an OT or not thinking as an OT. Um, so I just want to create more of them, but so that's what I like about academia is just like teaching other people. Um, and then because I'm still pretty heavy, I'm heavier still on the clinical side than the academia side. I wouldn't say there's really anything I really miss about working in the clinical setting. Um, the only thing between going from like full-time to part-time is just kind of like your presence is more sporadic. And so you have like a little less ownership over your own patients because you have to share them with other people so that they get seen appropriately. But it's hard to like feel like you're getting in a groove with like working with a specific patient over time because it's just a little more interrupted. But um, yeah.
Kind of touches on some similar themes that you guys have discussed, but how does or how did clinical practice prepare you for the current position you have in academia?
I'll say that when you work with patients, you have to be really good at like we use the term therapeutic use of self. So being good with connecting with people, you have to balance a lot of things. You have to be able to communicate your intentions and get buy-in, like execute a plan, check in, look, make sure that you did was effective. And I think education is the same way. Students are very into understanding why are you teaching me this and what do I have to get out of it. And I think patients can kind of be the same way. I also think that clinical practice teaches you a lot of critical thinking skills reasoning. And I think academia requires that as well. You constantly are thinking about like, okay, what's next and why am I doing what I'm doing and how can I be better about what I'm doing? And so I think some of those skills translates over well. And to Carolyn's point, when you take lots of students, you're experiencing so many different learners and a variety of people with a variety of backgrounds. And I think that also helps prepare you well for academia.
Mhm. And I think in terms of teaching, if you're teaching like a content specific heavy course, like to have done it for 3 years, or, however, 5 years, whatever, however many years, but to have been fully engrossed in the actual practice of it, I think makes it easier to then teach it to other people because you really have a good grasp of like what it is and what it looks like. You've done it a bajillion times. You can give students like kind of like the full spectrum of what you can expect in different situations related to the clinical content. So I think it just like deepens your own understanding of it to then help you teach it to somebody else.
What helps you balance being a practicing clinician while also teaching? And how does one role make you better at the other? Great questions, man.
Carolyn, do you want to take that one?
Sure. Honestly, not being full time at any one of the jobs is how I balance being a practicing clinician while also teaching. But I think right now in my life, like I also have two young children. Being like adjunct faculty, so I have a taste of it. I'm building my resume with teaching, but I'm not overly committed right now. Um, and especially the program that I teach in, with so many of my weeks being asynchronous, that also kind of decreases like the time load that I have every week. So I think just like by not, for me right now, it's not overcommitting myself to too many things and just being realistic on like how much time I want to spend towards work at all, versus how much time I want to spend with my children and just like balancing all of those things. Um, I still have things that like I still want to do at some point, but I'm more right now just kind of like, okay, I'm not ready to do those things, but what sets me up for success when I am ready? And so even just showing that I've been adjunct faculty for, at that point, maybe it's been 5 or 6 years, just gives me some kind of teaching on my resume to just help me get the interview for whenever I'm ready to do more.
What? Any other questions, y'all? Again, feel free to unmute or throw it in the chat. Could be anything from, again, their experiences, but also maybe their experiences as students as well, right? People that have all gone through the application process of going to OT school and what the experience of OT school is like. Awesome. What about the application process did you find was the most influential in your acceptance to Rush?
I would say at the time I had a lot of observation hours in a variety of settings, and I think that really helped me write my personal statement to speak to my confidence that this was the right field for me. I think another thing that was helpful for my acceptance to Rush is during the just taking obviously the required coursework, but then being able to connect that to like, and here's why I'm going to be a good OT, because that's all they want to know at the end of the day is like, why do you want to do this and why are you here? And so being able to speak to that, exposing yourself to different areas that OTs could potentially work in, I think makes a big difference in your application, helps you stand out. And I can say like being on the admissions committee now at Rush, we look a lot at like how involved you are in different aspects of things because it doesn't take just one skill or one aspect to be an OT. So the more variety of experiences you have, I think the more well-rounded of an applicant that makes you.
I would agree with like the variety of experience of observation and clinical hours. I think especially because so many people go into OT thinking that they know where they want to practice when they come out, and then through the process of OT school and their clinicals, they realize that they want to practice somewhere else. So I think the like more variety that you have in observation before you go into the program, the better you'll kind of be able to know that OT really is the right fit. Because like I think I first thought I would want to work in the schools, and then by the time I was done with OT school, I was like, absolutely not, do I want to work in the school? So it just like totally changed. Um, so I think the more variety of the experience you have, the more you know that you actually like the profession and not like the one OT that you shadowed. Um, so I think that just helps. I'm guessing like Rush or any program feel like, okay, they know what they're getting into with this and they still want to do it. So that's a good sign.
And I want to add to what you said, Carolyn, about the difference between like I want to be an OT versus I like this OT is so big because like you could have a wonderful person that you're with and this profession not be for you. And I mean, even before I applied for OT school, I was like still debating between like social work and family law because I knew I wanted to work with kids. I knew I wanted to help people, and there's a lot of different ways to help people. And so I think being very discerning with like in what capacity are you trying to help is so important. And making sure like it's OT that you like and not that person. So that was a great point.
There's just too many good ones out there, guys. That's the problem. On to our next question. What were the most helpful skills you have taken from your OT education into your current positions?
I would say the most helpful skills we talked about like critical thinking. I think being able and being comfortable with like putting yourself out there. You know, when you're like a therapist, you're meeting a lot of different people, you're introducing yourself, you are like pitching this idea of therapy and like why it's necessary, and you're constantly educating people. And I think you just get comfortable with this idea of like I know what I'm here to do and I feel confident in my capacity to do that and to serve them. And I think that translates well into education because Carolyn, you can tell me if I'm wrong. People can tell when you're afraid. And so like building your confidence is so important. And I think when you first start, you're like, I don't know what I'm doing, and like I cannot believe someone's gonna let me be their OT. And that same feeling happens in academia of like I cannot believe someone's gonna let me be their teacher and like let me be their capstone coordinator. Like who am I to be this person for them? But I do think like as you get confident and you know your stuff and you develop those skills, it helps you get confident in other areas. And especially if you're teaching in an OT program, like you're a product of that education. Like you know what it takes to be an OT and also a recipient of OT education. And so I think it helps you feel more confident eventually down the line of like, okay, I can do this. Like it'll be okay.
Yeah, and I think also like having a good foundation in the basics, it, like just helps ground you in the sense of like, okay, if this particular situation that I'm seeing in practice is not exactly what I studied in OT school, which happens a lot, um, like what do I do? And so I think being able to kind of like go back to the some of the foundational concepts that you learn in school and then use critical thinking that you practiced a lot in school to see like how can I take the information I know and apply it to this new situation. Just kind of helps you like deal with the wide variety or the kind of different situations that you see in real life as opposed to like in the textbook.
Are there parts of OT school or Rush that directly introduce you to academia?
I think the big thing was being on the admissions committee. So Bridget had invited me to be on the committee when I was a student, and I stayed on as an alum, and then I still do it as a faculty member. So I think that part is was really insightful to me of like what does it take to become or get admitted into these programs and what are we looking for? And I think something in OT school, just like saying yes to everything. And so if your faculty needed help with a lecture, or if your classmates need tutoring, or if anything like kind of comes up that relates to teaching or anything like that, saying yes to it just to see if you like it or not. I didn't never thought I wanted to do academia until I kept saying yes to all these things. And then Bridget and Dr. Roselli, who's a program chair, is like, "Hey, I think you might like this. Like, what do you think about that?" And I always thought like, "No, no, no." But I think just there are lots of opportunities, especially in a doctorate program, to get some more of that education because you have a little bit more time. And so giving yourself exposure to different things is, I think, the best part about figuring out if this is for you.
I think back when I went well, back when I went to the program, it was still a master's program. So there was a little bit less of that available. I feel like I just had really good relationships with like Dr. Roselli was not the program chair at that time. She was just one of our instructors. So her and a few of the other faculty who aren't there anymore, I felt like I just had good relationships with them. Um, and so, I mean, I could ask them questions and this and that, but I also just felt like we get along and you like doing that. I wonder if I would like doing that, like that kind of a thing. Um, but like, I think like I knew that the PhD in health sciences program that Rush has, I knew it existed probably only because I went to Rush. And I don't remember like how I first learned of its existence, but um I remember, like, I think that's why I knew about it. But then also, I remember having a conversation with our previous director of the program about, like, hey, I think eventually I would want to teach. Like, what do you recommend? Like, you as a program director, what do you look for in faculty when you're recruiting people to the program? Like, just I could pick her brain on, like, what she thought would best position me in the future as a candidate to be faculty. So I think just like, having the relationships with the faculty in the program, um, and then being able to ask them whatever questions kind of come up in the process can be really helpful.
I will jump in here and say, because I send a lot of emails to our alums, is that on the exit survey for when you graduate, we ask you, would you like to be involved in things at Rush like guest lecturing or being a lab assistant or things like that? And the ones that say yes, we go back to that sheet all the time and pull their names when the fieldwork coordinator needs lab assistants for a sim lab or they need practical help for when they're learning to do wheelchairs and things like that, or if someone is going on vacation and they need someone to do a guest lecture. So we do try to keep in touch with our alum and give them opportunities if they want them.
Hence tonight's activity as well. We keep them busy.
Well, and Ashley, correct me if I'm wrong, but you used to come in to do oral comps before you were a faculty, correct?
Yeah, I did oral comps. I helped Bridget with her documentation workshops. I would help Piper with her transfer labs. Like anytime you guys ask me to do something, I'd be like, okay, sure.
Yeah.
And now you're the capstone coordinator. Look at
Yeah.
that.
Surprise, surprise. Much to my
Yeah.
surprise.
Fun fact, Ashley did my oral comps.
And you did
It,
excellent. I was
thank
very
you, thank
impressed.
you.
Yeah.
We made it here. Okay, our next question is, some people say it's not recommended to have a job during OT school. Would you agree, or is it more manageable than expected?
I had a job up until we started our level 2 fieldworks. So I was a rehab aide at Athletico for like 12 hours a week. It was like 4 to 8. So it was like right after class. We didn't have class on Fridays, so I could work a little bit more. They also had a weekend, so that flexibility was nice. I had to stop when we went on our level 2s because level 2 is a full-time experience where you have to be at your clinical for 12 weeks, 40 hours a week, and you're just like so cognitively burnt out at the end of each day when you're learning how to be an OT that it was really hard to keep up with. And so that's when that transition happened. Some of my classmates also had jobs, and usually, like when level 2s come around, is when people taper back. You also want to be really mindful of having a job that's flexible, one with your school schedule, but two, flexible in that you have time to do your homework. So if you have a job that doesn't allow you to have your computer out or doesn't allow you to have your books out, it can be really hard to balance the two while you're in school.
I feel like a lot of my classmates who did work, if I remember correctly, would do kind of more like nannying or like a few hours an evening of nannying or maybe waitressing or something like that. Because you do, like Ashley said, you need to have the flexibility. But I wouldn't say like it's not possible or it's a bad idea. I think a lot of people do it. Especially if financially you need to, like there's certainly a way to make it work, but I would just be like picky almost in what job you take, just so that you can make sure that you're still able to do the things for school that you need to do.
I know that also, like, one of my good friends from OT school did a work study position that was really nice at Rush, where she worked at part-time in a lab. But of course, they knew that she was an OT student, so they were really kind and flexible with her hours. And she also got a lot of cool experience seeing like a different clinical side. So also another option that's out there too. Okay. What influenced your decision to choose Rush over other institutions?
Um, so to be honest, I primarily picked Rush because I'm from Chicago, so my family was in Chicago. I was able to live at home for a year before I moved out, just like it made sense. After going to school though, and interacting with students from other programs and things like that. Um, Rush had such a better like clinical integration and focus and like Rush turns out really strong clinicians. And I think for the majority of people who are going to OT school, they're going to be clinicians. Um, and so I think that was like a really strong point for Rush. Like a lot of programs, they're not over, and again, Rush might have changed since I went there, but they're not over in the hospital in the first semester that they're there, like they're not shadowing and observing. And I think being connected to the hospital and the many different kind of areas of healthcare that Rush covers, outpatient, inpatient, mental health, acute care. There's just so much access to so many different areas of practice through Rush that I think a lot of programs just don't have that same access. And so for me, I think uh, just the strength of the clinician, and which is also, partially because of the strength of the faculty being strong clinicians, whether currently or at some point in their life. Um, that was like I could tell a difference when I went to my fieldworks and I was at fieldwork sites with students from other programs. Um, so that would be like the my biggest selling point for Rush.
I was deciding between Rush and another local institution, and Rush gave me full rides. That was a big decision for me. But also, I like that we had a different admissions coordinator at the time, but like they reached out, when I said I'm kind of in between two options, and they were like, "What can we do to make this happen for you? What do you need? Tell us what you like about our program, and we can affirm that with you." And I thought that was really special. I liked that Rush, to Carolyn's point, had such a big focus on our clinical skills. So semester one, you're doing practicum. Semester two, another practicum. Semester three, another practicum. You're doing your level ones. You're doing your level twos. Like there was never a semester where you weren't doing something clinical, and I really appreciated that. And I think the variety of fieldwork options too was a really big deal. Like I wanted to be at a place where I could try a little bit of everything, and it seems like some schools have different specialties, but I feel like Rush's focus was really on like strong clinician, and because it was a doctorate, like also research. I never knew I wanted to do research, but I'm like, if I feel like I can give it a try at a place like this, and I'll have lots of support to do so. And so I think just having so many options and the intentionality behind the program was really important to me, and a big decision of why I chose to come here.
Excellent. We have about like 15, 20 more minutes. So again, great time to get your questions in. Um, Share anything that like maybe you're thinking about or you're stuck on.
I don't know if anybody might have questions about the capstone experience or taking your NBCOT test after you graduate, prepping for NBCOT, things like that. These are the people to ask about that stuff.
Solid. What did you do for your capstone experience?
Well, Daniela, why don't you go ahead?
Yeah, you
Start it
can
off.
do that.
Me?
You're an alum,
Uh,
yeah.
I so my family's originally from Bolivia, and I thought that would be a really cool way to collide two worlds. I love OT and I love my family and where I'm from. So it's from the first semester, I was like, I'm going to figure out a way to make this work so that I can do both. And I worked really closely with our capstone coordinator and other faculty at the time to see what opportunities they were. So I researched different programs that would I quickly learned that OT is not that big of a field in Bolivia. But I wanted to do some sort of work, right, with a population that I'd be interested in working with, and that's primarily kids and adolescents for me. And so I ended up finding this non-for-profit that worked with adults and children with Down syndrome in the city that my family is from. So from there, I needed to come up with a capstone project. And so I actually partnered with another one of our faculty that works with Gigi's Playhouse that also has a similar mission of caring for children and adults with Down syndrome. And I took one of their curriculums for health and wellness, and I adapted it to be culturally relevant and inclusive for a Latinx Hispanic population. So what I did was I adapted their program so that they could do it at Gigi's Playhouse Chicago, but also so that it could be done at my capstone site in Bolivia. So I spent 12 weeks in Bolivia running those groups, as well as providing services to a variety of different families, adults, children there as well, and giving presentations to them, as well as checking in with Gigi's to see how they ran a wellness retreat based off of the curriculum that I adapted. So yeah, that was super fun. That was definitely like a dream come true for me. And again, it wouldn't have been possible without lots and lots of supports and lots of kind of digging into different experiences.
For my capstone, I did it in early intervention and I was looking at parent mental health and resilience in low-income families. I didn't think I wanted to do pediatrics, but I wanted to make sure. So I thought capstone was a good opportunity to try it. And I found that I really loved like the connection in the community aspect of early intervention. So kids who are 0 to 3 years old and their parents, and also working with families of color. I thought that we just know that there's less access to care, less access to specialists, less access to therapists. And it was so important to me to be able to give back to my community and also see what was happening here on the west side of Chicago. And I just thought that capstone was a really great way, one, to make sure, like, is this what I want to do or not, but also just to be able to Danielle's point, support people who have shared experience with me and to further amplify some of those voices and those positive experiences with the healthcare system.
And I got my master's, so I did not do a capstone. But I did a PhD, so I did a dissertation. And I worked with a research lab at University of Southern California. It's called the NICU Therapy Research Lab. So I was directly involved with with research in the NICU, which is my primary area of practice. So that was really fun to just see like a different lens of an area of practice that I'm so involved in. And I specifically was kind of doing the foundational research needed to create like an oral motor intervention program to help preterm infants learn how to eat.
I love it. They're all so different, but also special. Love it. Um, Next two questions I'll tie in together. Did you guys feel that Rush prepared you for the NBCOT exam? And then what helped you most when you were preparing for the NBCOT?
I would say yes. I took my NBCOT exam right like at the peak of COVID, so that was really hard, but I do feel like Rush was really good. They brought in people to help us study for the exam. During our curriculum, we take practice board exams, which is really nice. And then a lot of the questions in the different courses are written to be a comparable level as NBCOT exam, and one of our faculty members actually wrote exam questions. And so I thought like we had constant exposure to that, and that was really great. And then now as a capstone coordinator, my job also is to do that NBCOT prep with the students. And so we start a year in advance, and we find that when students prepare and pass the practice one while they're in the program, they tend to do really well on their first attempt when they take the real thing. And if they need more supports and they don't pass on the first time, our program director is really intentional about reaching out to them, asking what supports they need, connecting them with alum to help them pass on that second attempt. And so there's a lot of services around ensuring that, you guys can pass and do what you need to do.
After graduating from OT school, what was your first job, interview, and experience like? This is a great one that I don't think has ever actually been asked in any of the Q&As, so this is impressive.
Um, so my first job was it was early intervention and outpatient pediatrics was my full-time job. And then I also worked PRN in a hospital in acute care. Um, for the interview, like, I mean, you have a decent amount of clinical experience at that point, right? Because you've done your field works and your capstone. So you do have some experience to pull from when you're interviewing. But honestly, I feel like the strongest point when you're interviewing is just your interpersonal communication and skills, and for them to feel like you're somebody who they can teach because you still learn so much, and like your program teaches you to be a generalist, right? Like you get a little bit of everything, you kind of cover the full gamut of OT. You might get more like specific and direct experiences, obviously in your field works and through your capstone, things like that. But there's still like a lot within whatever area of OT you want to go into that you don't yet know. And so most employers know that there's still a lot of teaching and training that's going to happen with a new grad OT. And so I think, yes, highlighting the relevant experience you've had is helpful, right? So they know that you're coming in with a pretty good knowledge base, but also just making it clear that you are teachable, and that you like can get along with the other therapists on the staff. And you know what I mean? Like people just want a good work culture. And so if they feel like you can contribute to a positive work culture, they're more likely to hire you, even if maybe some of your clinical skills aren't as strong in that specific area as somebody else's. So I think um, as a new grad, just, showing that you, from a personality or interpersonal standpoint, that you would be a great person to have on staff can just be a, a good selling point for yourself.
Yeah, and to Carolyn's point, I think a big thing too they want to know is that you know when you need help. They want to make sure that you're going to ask for help and seek out mentorship if you need it, versus just assuming you got it and potentially making an unsafe decision. So a lot of the interview was about like what are your problem solving skills and like how have you handled challenging situations and when do you know that you need help and how do you go about figuring that out? My first job was in acute care. I've always worked in acute care. I joke with Michelle and Bridget, I've had a lot of jobs. So I, a big thing for me is when I'm looking for jobs, especially that first like 3 years I was out, was mentorship and like honestly pay. So like making sure that I was compensated fairly, but also did these level 1 like academic medical centers have appropriate mentorship? Like, is there someone I can go to with each rotation? In an acute care, you really do have to be a generalist, to Carolyn's point. And so making sure that they have the structure set up to, can I be successful in cardiology and oncology and neuro and ortho if I have to see like these different settings all in one day? And that was like a big thing that I was looking for when I was looking for my first job. And I think the experience at some places were better than others, but I think knowing what you want when you go into a job interview and like what your priority is, whether it's the setting or the population or what have you, and being able to work in that system is really important.
And I think like a lot of times, a- so a lot of people get their ideal job straight out of OT school, and like more power to them. But a lot of people don't. Like it's just there's only three people in your ideal job and they all have more experience than you, right? So I think also kind of thinking about like where do I want to go and what can I do now that works me towards getting there. Um, it can be helpful. Like for me, I wanted to be in pediatric acute care, but there just wasn't anything available at the time that I was graduating in Chicago in pediatric acute care. And so it was like, okay, well, pediatric acute care will appreciate if I have a really strong foundational knowledge in pediatrics, early intervention, like development. So then I started looking more towards like outpatient pediatrics and early intervention. But then knowing that I wanted to eventually be in acute care was what drove me to doing PRN, acute care, even though if it was with adults, I was showing that I could work in like a more critical setting as well. So then eventually I would want to like marry those things to be pediatric acute care. But because I couldn't do that right away, it was kind of like, well, what can I do that still serves that long-term goal?
What is something about OT school that surprised you, and what advice would you give to students preparing to start an OT program?
I feel like OT school was both harder and not easier, but like you do figure it out. But that first semester is just so humbling because you feel like you have to be perfect to get in. And now you're with all these other people who had to be perfect. You're like, oh my gosh, everyone here is smarter than me and everyone knows more than me, but that's not true. You guys all know the same and you guys are all equally wonderful because that's why you're in your cohort. But I think the surprise of like how resilient you can be, you don't think you can do hard things really until you're asked to do so. And I think I just surprised myself with my work ethic. I think you have to be a hard worker to get in. And now this is something completely different than things you've learned in the past, right? Like kindergarten prepares you for college, middle school prepares you for college, high school prepares you for college. College can or cannot prepare you for grad school. It's kind of like up in the air. And so I think that surprise of like, wow, I didn't think when I started my first semester in OT school that I would be here to like where I am right now. So I think like grit and resilience that you develop. And I guess my biggest advice when you're starting an OT program is just being open to the process and understanding that like when things get hard or when things get frustrated, like everyone is there to support you. And you have to go into it with like an open mind that you're here to learn and you're not going to be good at everything right away, and that's okay. Like if you knew everything you needed to know, you wouldn't have to go to school. They would just let anyone be an OT. And so trust that you made the right choice for yourself, but also that there are people there along the way to help you. And whether you go to OT school right away or it takes you a little bit longer to get in or it takes you a little bit longer to finish, you're going to be an OT at the end of the day. And that's okay.
Um, I think the one thing that surprised me the most was how many people in um, the program like came in thinking that they knew what they wanted to do as an OT. And then that changed during the process of being in OT school, whether that be because of their practicum experiences or their level ones and level twos. But like, I mean, I think half our class came in being like, I'm going to work in pediatrics. And like by the end of it, there was like three of us who did, right? Like, um, so I think like the biggest advice would be to just be open. Like you might think, oh my gosh, I really wouldn't like hand therapy, but you do a level one in hand therapy and you're like, wow, I really liked it, you know? So I think that's a really nice part about all the clinical experiences that Rush offers is that the more variety that you take in those experiences, the more kind of exposure you have, and you might realize that there's an area of OT practice that you might not have even known like OTs work in that area. But then you experience it and you love it. So doing things that just give you that variety throughout the program so that you can just kind of stay open to what area of OT you might actually want to end up going into.
I'll just tag along in this just because I always love this question, but something that surprised me, I think once, something that I had always heard is that OT, particularly whatever area you live in, right, is like it's a small community. And I just thought it was like a wives' tale. Like I was like, okay, that's silly, but that's cute. But it really is true. The OT community is pretty interconnected. A lot of people that you work with or that you know of or that you've had a clinical with also know someone else that knows that person that used to work with them or currently work with them or they were their student at one time. Um, which is actually a really wonderful thing. Because that way, like again, it's kind of like instant networking in a way, right? And I'll say that a lot about the OT program at Rush too. Like I didn't expect that necessarily. I kind of expected it to be like prior to grad school where I was working really hard to make a lot of connections for myself and trying to get to know a lot of people. I don't have anyone in my family that's in healthcare. I don't no one in my family knew about OT. They're still really working on their knowledge about OT, right? So I was like, okay, I'm really on my own. But it's surprising like the amount of connections that you're able to gain. And also, again, if you ever had like a curiosity or a thought of like one day I was like, what is mental health? What does mental health OT look like? I was like, can I join you? Can I come with you to work? And they're like, sure, fine. That's all good with me. To like faculty or even like a friend of a faculty, right? So that was also really nice and surprising too, just like the connections that you make along the way. Sometimes they're very like, yes, like I purposely asked to be connected to this person or it's by happenstance. But I think that's a really beautiful part about just OT in itself. Like everyone, it seems like everyone wants to give back, in some way, shape, or form. Everyone remembers being a student. Everyone remembers being an applicant, right? Those are necessary steps that you have to take to be an OT. So, um, it's always nice that people are willing to share their knowledge and expound on that, just like you guys tonight.
Daniela, to your point, like every job I've gotten since graduating is because someone knew someone. Like I got my first job because one of the therapists there was a Rush alum, and then I got my second job because the therapist who used to work there that then worked at the new place worked at my job. And like, oh my gosh, you know so and so, great, like come into an interview. And then I got this job because, Dr. Roselli, I was her student. And so OT is so small. And I've like worked across the country and people are like, yeah, Rush alum, like come on over. So I think what's beautiful about our community is that because there's so few of us, we want each other to thrive. And it's so wonderful to be able to, you never know who's like going to help you along the way. And so would love to have you guys as future colleagues and I'm happy to see where you all end up.
Absolutely. On that note, that practically brings us to 6:30. Maybe we're off by 1 minute, but thank you all. I'll end it here on this joyous note. Thank you all so much for joining us tonight. Thank you so much to Ashley and Carolyn for sharing their experiences. For Michelle for also being on this call, and thank you to all of you guys for your wonderful, wonderful questions. Sincerely was very impressed. And for getting to know a little bit more about occupational therapy, getting to know a little bit more about Rush, and where they both intersect. So thank you both all so much. Have a wonderful evening. I'll stay on for questions if you guys have anything additional you want to chat about. But otherwise, have a good one. Thank you all.
Bye, everybody.
Thank you.